Good evening, study partners. Welcome back to Wednesday Night Study Live, where we gather to complete study practice questions so we can pass our addiction counselor exams. Welcome back and good evening. If you're new here, welcome. I'm Letitia, a licensed professional counselor and licensed substance abuse treatment practitioner. By day, I am a therapist and mental health educator. Over here on Tiesha Talks Mental Wellness, I make substance use and mental health education videos, and I specifically have been making addiction exam study prep videos to help you and future counselors pass their addiction counselor exams. So welcome, come on in. Good evening. Happy you're able to join us on our Wednesday night study live. All right, come on in. Let me see what the chat is talking about. All right, study partners, if you are new here, we gather here usually at 7 o'clock. But for August, we have been doing intensive study sessions where we meet for 3 hours. So tonight we'll have three separate topics, 1 hour each, 10 questions each. And I will read the question, pause, then you will put your answer in the chat. And then I reveal the answer and I give explanations for both correct and incorrect answers to double your study power. We meet together to one, hold ourselves accountable, to study and educate ourselves as clinicians and future clinicians. Also, it helps us with our clinical reasoning and it helps us master foundational addiction topics. Before we move forward, I would just like to say thank you for 3,000 study partners. Yay! I need some special effects or something. But just pretend confetti is falling and you hear, all types of celebratory sounds. I'll add them when I get better. But thank you so much for 3,000 study partners. You guys have been great, so supportive. You have been watching the videos, supporting the videos, liking the videos, and they are reaching our other study partners because on this little corner of our internet, this part of the internet, we're over here studying and preparing for certifications, just working as clinicians and becoming better. So I do appreciate you all for the support of the channel, and continue to like and share and save so we can make our way to 5,000 study partners. Yeah, we made 3,000 study partners, you guys. I can't believe it. Good evening, Doreen. Good evening. Okay. Now I'm going to announce over the past 7 days, we had one study partner to report passing. Let me get it together, y'all. Good evening, everyone. Good evening. And congratulations to our study partner, Francois. Francois wrote, I just took my CADAC 2 exam today and I passed it. Thank you so much for helping. If you get a chance, he posted or they posted under the co-occurring disorder video. If you get a chance, go ahead and congratulate Francois. Thank you so much, Francois, for supporting the channel, and congratulations to you for passing, I believe, the CADAC credential. They have to take the ADC. So congratulations again. I love seeing study partners pass the exams. It just motivates us and helps us to continue to grow. And again, thank you all for 3,000 study partners. Thank you so much. Let me take a peek at the chat. Good evening, Marceline. Good evening, Chickadee Chick 12. Thank you. I appreciate you. Thank you for supporting the channel. All right. And I want to say hello to the playback. Hello, playback. Some of you emailed me and said you couldn't make it. You had to work. You had school. No worries. I'm saying hello, playback. You still have to study. So you watch the entire video, answer the questions, and put in the comments where you're watching from, or if you're already a study partner, let me know what you've been focusing on, what topics or subjects you need more work on, what topics or subjects you would like to see videos on. You're here in spirit. Also, for those of you who want to know how to support the channel, first of all, like this video. Okay, chat. If you're live in the chat, go ahead and like it as you come in. Also, if you're watching this video, make sure you're subscribed to the channel so you never miss a study video. When you're subscribed, they send you emails when I upload new study videos, and you will be able to see my community posts when I post on the community post. Also, watch all of the videos to the end, especially if you are preparing for some type of addiction counselor exam. Make sure you watch the video to the end so you get, all your study time in. Share or save this video. If you run into a video that you particularly felt like was helpful, you can always go back to it. I have a playlist. All of that is in the description of this video. I have a 12 core functions playlist. We have practice questions playlist. And from what you guys tell me, they've been very helpful. So just make sure you're sharing the video or saving it. You can hype the video. I think the hype button is on mobile under the video, and hype is just like, I think, the star button, and you're just saying, hey, this video is great. People should know about it, and it tells the algorithm that people like this video. If you're in the live stream, other monetary ways you can support the channel is a super chat. Also, there's a super thanks button if you're watching the playback, if you want to send something monetary. And I also have Buy Me a Coffee, PayPal, and Cash App. Thank you so much for those of you who sent me Cash Apps and Buy Me a Coffee. I indeed bought myself 2 coffees. I mean, I don't know if that's a good or a bad thing, but thank you. I do appreciate it. When I'm making videos or I just need a cute little break, I'll go up to a coffee shop up the street from me. I get my favorite latte, or I'll run to Starbucks or something. I really am appreciative of your support of the channel. So again, thank you guys so much for 3,000. We're on our way to 5,000 subscribers. I really think we're gonna get to 5,000 very soon, because we find each other. There's like hundreds and thousands of addiction counselors, drug counselors, chemical dependency counselors, counseling students all over the country, all over the world. So as you push the videos in the algorithm, we'll find each other. And this will be our little spot where we meet up and study and get better as clinicians. All right. I'm going to check the chat one more time before I get started for the first hour. All right. Good evening, everyone. Good evening. Unique Johnson says, I'm getting ready to take my LCDC2. Thank you for helping me so far. Thank you for being a part of the community. And best wishes to you on your LCDC2. Are you taking the ADC or the AADC? I'm going to guess the AADC. All right, we're going to go ahead and get started today, guys. Hope everyone is well, taking care of ourselves. Okay, Unique, the ADC. Awesome. You could be anywhere in the world, but you're here. We're all gathered. If you've been having a hard time, take a pause, take a breath, because just daily life, handling the basics, it can get stressful. But we got this. All right. So hour one is going to be on counseling, attending, and rapport building. So all 3 hours tonight is going to have something to do with counseling skills or just something under the counseling skills umbrella. That's very broad. But I try to have it so that all three topics are connected. This is really the foundation of counseling relationships. Before we can talk about our treatment goals, behavior change, and supporting our clients with relapse prevention or recovery, we have to understand how to engage our clients when they're right in front of us, sitting with us. Now, this is the third most requested topic, you guys. The first most requested is pharmacology, basics, or medications. The second most requested topic is ethics. And then the third most requested topics is counseling skills, because some of us are mental health professionals, but we haven't worked in the capacity of providing addiction counseling or drug counseling in terms of using like those basic counseling skills. So many of you have requested counseling skills videos, and just feel like you need a little bit more extra support in learning how to attend to clients and sitting in sessions and actually talking in front of people. It can be very intimidating. It can be overwhelming, but if you feel like you enjoy it and you feel like you're going to be an addiction counselor, not just an addiction professional, you're going to be a lifelong learner, because you never really feel like you know everything. You can't be a good clinician or counselor. If you're providing therapy, you're always learning. You always have to show up. So if you love learning and talking to people and meeting new people and being surprised and challenging yourself, actually doing the actual addiction counseling in the therapy, you're gonna enjoy it. During this hour, our questions are going to focus on skills like active listening, empathy, attending, behaviors, when to use open-ended questions, reflections, all of that. You'll also need to recognize concepts such as transference and countertransference when you are working directly in addiction counseling therapy sessions. When we work through the questions, pay close attention to what the question is actually asking. Remember, on these questions, the best answer is often the response that allows the counselor to listen, explore, clarify, and understand the client. All right, let's get started. What you need to know about attending and rapport. So you need to understand how to attend to your clients, meaning sitting with them, talking to them, how to listen, how you show up, how you pay attention to the nonverbal cues. Also, do you understand the core or the basic counseling skills? Also, how you display empathy and validation, and how you make sure you're always presenting from a non-judgmental approach. And people think that's easy. You have to actually do the work to show up and not let your bias get in the way. You have to be honest about your own bias, your own judgments. And every time you sit with a person, you have to remind yourself, I am open to learning. I don't feel like I'm right or another person is wrong or I'm wrong. We're just having an experience and I'm here to support them. That's something you have to constantly work on, because we're human. So if you can be honest about what you judge people for, and you can kind of check yourself and learn how to attend to your clients with a non-judgmental stance, you're going to be great, because you constantly going to have to work on it. And this is what they're going to be testing you on, certain exams. If you get in a question about counseling skills and rapport building and having a non-judgmental approach, keeping your sessions person-centered, understanding boundaries, understanding that, you have to see the client from their perspective and what their cultural norms is and stuff like that. They want to see if you understand that, because that is how we make sure our clients stay safe. Skills. You have to be able to build rapport. So you have to be able to establish trust. Even though you're asking these very personal questions, again, We work in a field where we specialize in very touchy, sensitive subjects. We're dealing with trauma topics, drug use topics, abuse topics, all of the above. And some of these things they have never told anyone else. So they are trusting you with their most deepest, darkest experiences. You have to learn how to actively listen, observe cues, because again, we know when people are in this like an incredible amount of pain, sometimes we hold things in, but they show in our nonverbal cues. So we have to be able to understand those cues that our clients give us to make sure they remain safe. And we also have to stay present. We have to be able to communicate effectively. I hope I'm not overwhelming anyone who's never done therapy with a client. But again, it's something that you continue to get better at. You learn and you stay in supervision. You talk to colleagues. You ask for feedback from your clients. You literally are always learning how to do better. And no client is the same. So it's not like you could really get bored. Like you can never feel like, oh, I got this. You never feel, I don't know a therapist that ever says, oh, I got this down pat. Because the minute you think you mastered an intervention and you've done this, this is a long time, you get a new client and you go, oh, I don't really know it all. And I'm learning. But that's a good thing. So on the exam, you need to be able to recognize these concepts. So these are the skills. Demonstrating empathy, and more importantly, just maintaining and establishing the therapeutic relationship. So there's a difference between building rapport in the beginning and then working long term with clients. You're working with them through towards recovery. And guess what? The relationship might change because the person that walked through the door who was new in recovery, if you work with them for some time, you guys have built this therapeutic relationship and things may change. Circumstances may change. So you have to continue to keep their trust, build their trust, and maintain the rapport, even through, changes. Okay, guys. Can you put a 1 in the chat if you can hear me clear? I want to make sure I'm clear. No glitching before I start the questions. Thank you, Jamie. Thank you, guys. I'll go ahead and get started. Question 1. A new client arrives for an intake appointment appearing guarded, shifting their seat, and speaking in short, clipped sentences. They state, I'm only here because my partner said if I don't get fixed, they're leaving. The counselor wants to prioritize engagement and rapport building before moving into clinical data collection. Which of the following counselor responses best utilizes empathy and active listening to foster initial engagement? A, your partner is clearly concerned about you. What behaviors has caused problems in your relationship? B, it sounds like you're feeling pressured to be here and may not be sure that counseling is something you want for yourself right now. C, I understand how you feel. Many clients are uncomfortable when they first come to counseling. Or D, before we discuss your concerns, I need to gather some information about your history so I can determine how counseling can help. Which one of these responses best uses empathy and active listening? Okay, I see some C's, I see some B's. The correct answer is B. It sounds like you're feeling pressured to be here and may not be sure that counseling is something you want for yourself right now. B is correct because the counselor reflects the client's experience of feeling pressured and acknowledges their uncertainty about counseling. The response demonstrates understanding without judging, confronting, or immediately gathering information. It also gives the client an opportunity to continue sharing. A is incorrect because it moves too quickly into forming information gathering and assumes that the partner's concerns are justified before exploring the client's perspective. And C, which is a close distractor, remember the distractor is the answer that could be right or probably is right, but not the best answer. C is incorrect because saying, I understand how you feel assumes that the counselor fully understands the client's experience. Referring to other clients also takes the focus away from this client's individual experience. And D is incorrect because gathering history is necessary during intake, but the scenario specifically indicates that establishing rapport and engagement is the immediate priority. So the skill that you're being tested on in a question like this, they're trying to see if you can recognize counselor responses that reflect the client's feelings and perspective, that you can actively listen, you hear what they're saying, and you can reflect it back. You can demonstrate that you understand, and you can attend to verbal and nonverbal cues, and you can encourage the client to continue sharing without judgment. So the best answer would be B. Question 2. In the context of addiction counseling, which statement best describes the primary clinical importance of rapport building? A. Rapport allows the counselor to establish professional credibility so the client is more likely to follow clinical recommendations. B. Rapport helps the counselor obtain accurate assessment information by encouraging the client to answer all questions during the initial interview. C. Rapport establishes trust and psychological safety that supports honest communication, engagement, and the client's willingness to address difficult issues. Or D. Rapport creates a supportive relationship that allows the counselor to avoid challenging topics until the client demonstrates readiness to discuss them. Which statement best describes the reason for rapport building? Why do we need to get to know our client and earn their trust? Okay, I see some C's. The correct answer is C. C is correct because rapport creates trust and psychological safety. This is necessary for meaningful therapeutic work. In addiction counseling, clients may be discussing substance use, consequences, relationships, trauma, legal concerns, and other sensitive information. When clients feel respected and safe, they are more likely to engage openly in therapy or the treatment. A is incorrect because professional credibility can contribute to trust, but the purpose of rapport is not to increase the counselor's authority or obtain client compliance. The therapeutic relationship should remain collaborative. B is incorrect because rapport can improve the quality of information gathered during the assessment, but obtaining answers to assessment questions is not the primary purpose of building rapport. Building rapport extends throughout the counseling relationship. And D is incorrect because counselors should be sensitive to client readiness, but rapport does not mean avoiding difficult topics. A strong therapeutic relationship allows challenging issues to be explored appropriately and safely. So, the skill that you would need to know for a question like this is you need to understand that rapport establishes trust and safety, respect, and collaboration. Question 3. A client tells their counselor, I've been trying to stay sober for months, but every time I get close, I just feel like I'm waiting for the other shoe to drop and then I use. The counselor responds, it sounds like you're experiencing a pattern where your anticipation of failure creates so much anxiety that using becomes your way of coping with that pressure. Why is this response an example of effective active listening? A, the counselor uses a reflection that identifies the client's underlying emotional experience and connects it to the pattern of substance use. B, the counselor summarizes the client's statement to redirect the conversation towards developing a solution for the substance use. C, the counselor interprets the client's anxiety as the primary cause of the substance use and identifies what must change for sobriety to occur. Or D, the counselor restates the factual content of the client's statement without adding emotional meaning or interpretation. Which answer best shows that it's effective active listening? The correct answer is A. A is correct because the counselor goes beyond simply repeating what the client said. The response identifies the underlying feeling and meaning and connects the emotional experience to the client's substance use pattern. This demonstrates a deeper active listening while giving the client an opportunity to confirm, correct, or further explore the counselor's reflection. So again, reflection is good. Reflection, you just reflect back. You can literally reflect back the facts. But when you have deep active listening, you can reflect what the client said in different words, but also connect the emotion. B is incorrect because the counselor is not redirecting the client or moving into problem solving. The response remains focused on understanding and reflecting the client's experience. C is incorrect because the counselor is not diagnosing anxiety as the cause of the client's substance use or telling the client what must change. Effective reflection should encourage exploration rather than present the counselor's interpretation as fact. And D is incorrect because this is more than a simple restatement of content. The counselor identifies the emotional meaning beneath the client's words and connects it with the behavior pattern. So the skill for a question like this, you need to know the difference between simply repeating back what the client has said and reflecting the deeper emotion or meaning behind what the client communicates. So effective reflections with active listening demonstrates that you understand and can help them look at their thoughts, their feelings, and their behaviors. Now, I didn't say this was easy, like doing it, because as a baby clinician, I was like a robot because I was so nervous that I would reflect the wrong feeling or I reflected and the client was like, no, actually, I don't feel that way. And my whole chest got tight. I'm like, oh my God. So this stuff sounds, I don't know if it sounds easy to do or not. How many of you actually do addiction therapy? I know many of us are clinicians, but some of us work in like MAT, some of us work in the clinic, some of us. So it's something you just really have to you have to practice. You really have to be in there and practice your skills because just reading it back, I'm like, this is hard to do sometimes. But definitely it works. You get better as you practice. Question 4. A client receiving addiction counseling has consistently attended treatment for several months, but suddenly misses multiple appointments and does not respond to the counselor's initial outreach. Which action best reflects best practices in addiction counseling? A, continue scheduled outreach attempts, document each attempt, and close the case according to agency policy if the client does not respond within the established time frame. B, review the client's recent treatment history for indicators of increased relapse or safety risk and contact the client's identified support person to determine whether additional interventions is needed. C, make reasonable efforts to re-engage the client, explore potential barriers to continued participation, assess relevant safety concerns, discuss available options for returning to treatment, and document all efforts. Or D, send the client a written notice explaining the risk of case closure, provide appropriate referrals and crisis resources, and allow the client to determine whether they wish to resume treatment. Which best reflects best practices in addiction counseling? Okay, which one is best practice? So your client is starting to miss multiple sessions, multiple appointments, is not responding, they're going ghost. Okay. The correct answer is C. C is correct because it provides the most complete clinical response. Unexpected disengagement should prompt reasonable efforts to reconnect with the client, understand potential barriers, identify relevant safety concerns, and provide an opportunity to return to treatment. The counselor should also document the outreach and the outcome. So, this is the best practice and in counseling, but I would even say more because, again, we're a specialty. It's, first of all, relapse is a part of the work we do. Either the client is at risk at relapse, whether it's high or low. We know it's a possibility because of life stressors and depending on the ability, the daily life of the client. So if you get any question about discharging or the client not attending, the answer that just says, oh, just discharge them. Anything that sounds like abandonment, that is not the answer, because they want to see if we understand the nature of the work we do. And realistically, we do work where people are struggling. We are here to support them. We expect things to happen. They're going to continue to struggle as they get better. So the initial response to a client going ghost is probably not going to be, okay, I called 2 times. They don't want to come. You want to make reasonable efforts, meaning, they should be reasonable according to our best practices. I'll leave it at that. A is incorrect because documentation and following agency policies are appropriate, but it focuses on the administrative process of outreach and closure without addressing the clinical purpose of re-engagement. Because remember, we're supposed to be modeling them working through difficulties. So if we have a difficulty or we immediately wanted to say, oh, discharge, we're not modeling for them the unconditional positive regard. Now, again, it has to be reasonable. I'm not saying let the client case stay open forever, but we have to document that we understand the nature of the work we're doing. B is incorrect because reviewing recent treatment history for risk indicators, it is appropriate. However, contacting a support person is not automatically appropriate, and it will just depend on the client authorization, release of information, confidentiality. The counselor should first make reasonable efforts to contact the client. And D is incorrect because written notice, referrals, and information about case closure may eventually be appropriate if re-engagement efforts are unsuccessful. However, it moves towards termination before adequately attempting clinical re-engagement. So again, remember when you're testing, I know those of you who already work as a clinician, real life can be a little bit different. Your agency policies can be a little bit different. When you're taking your test and you have these scenarios, you're in a perfect world. And we're going to go by general best practices. We're going to make reasonable efforts when a client disengages. We try to figure out what's getting in the way. Have they relapsed? Are they having stress issues? Is there something that they need in the therapeutic treatment? Do they want to get a new clinician? Whatever the reason is, we have to show that we've made a reasonable effort to support them on what they need. The skill that they are looking for in a question like this: when several answers contain appropriate actions, choose the one that provides the most complete client-centered clinical response. So remember, if you have 4 choices and all of them seem like, well, I would do all of that. Like, none of these answers are like bad. None of these answers are like neglectful. But if they ask you something like the best response, you want to go with the response that ensures client safety and makes it about the client. So administrative closures and referrals may become necessary, but they generally should not replace reasonable efforts to understand and address the client's disengagement. Question 5. During an individual counseling session, a client reports they drank alcohol over the weekend after several weeks of abstinence. The counselor wants to better understand the circumstances surrounding the return to use while encouraging the client to openly explore the experience. Which question best demonstrates the use of an open-ended question? A. Were you experiencing stress before you decided to drink? B. Did being around your friends contribute to your decision to drink? C. How many drinks did you have and what time did you stop drinking? Or D. Walk me through what was happening for you leading up to drinking that weekend. Which best demonstrates the use of an open-ended question? Yes, Marcelina, A was a close contender, but for the incorrect explanation was that it focused too much on the administrative process without addressing the clinical purpose. Okay. For 5, the correct answer is D. Walk me through what was happening for you leading up to the drinking that weekend. D, it's correct because it invites the client to provide a detailed narrative about the experience. The client can discuss thoughts, emotions, triggers, relationships, circumstances. This gives the counselors more comprehensive information while keeping the conversation centered around the client's perspective. A is incorrect because it provides clinically useful information about stress, but it can be answered with a yes or no. It also introduces stress as the possible explanation rather than allowing the client to identify what was occurring. B is incorrect because it also asks about an important potential trigger, but the counselor is suggesting that friends contributed to the return of use. The question can be answered briefly and may unintentionally guide the client's response. And C is incorrect because quantity and timing are important when assessing substance use. However, these are specific information gathering questions that are more likely to produce short, factual responses than deeper exploration. So, closed ended questions are not inappropriate. They're not wrong because you're going to ask all types of questions, but they just serve a different purpose. So you don't want to get locked into the one word answers because remember, if they're talking about something that's sensitive, if they're feeling guilt, if this client is feeling guilty or less encouraged, they may lack motivation because they feel like they messed up or they relapse. It's easier just to say a yes or no. I know when I'm overwhelmed, if I know I'm talking about something that's sensitive, I'm going to be more likely to answer the yes or no question very quickly. Yes, no. So, again, closed-ended questions are not bad or incorrect. They just need to be used at a different time, especially during times when you have to support the client with opening up. So, open-ended questions encourage clients to describe, explain, explore, and elaborate. So, for questions like this, you need to be able to make the distinction between open-ended questions and closed-ended questions and how they're used in the counseling process. Question 6. A counselor is working with a client who was referred for substance use treatment following repeated alcohol-related problems. During the third session, the client states, I feel like everyone already has their mind made up about me. My family thinks I'm an alcoholic. Probation thinks I'm a problem. And now you're probably going to tell me what I need to do too. Which counselor response would best support the development of a therapeutic relationship? A. Your family and probation may be concerned because they have seen how alcohol has affected your life, so we should explore their concerns. B. I can see why you might expect that. My role is to understand your perspective and work with you on what you believe needs attention. C. I'm not here to judge you, but part of counseling will involve helping you recognize how your alcohol use has affected other people. Or D. What makes you believe that everyone has already made their mind up about you? Which answer best supports the development of a therapeutic relationship? Okay, I see a C. I see some D's. I see a B. The correct answer is B. I can see why you might expect that. My role is to understand your perspective and work with you on what you believe needs attention. B is correct because the counselor acknowledges the client's concern while communicating respectful, collaborative, and interest in the client's perspective. The counselor does not immediately defend treatment, side with the referral sources, or tell the client what needs to change. This response helps establish trust while clarifying that counseling is a collaborative process. A is incorrect because exploring the concerns of family and probation will eventually be appropriate, but the response immediately shifts attention towards the perspective of others. The client is expressing concern about not feeling heard, so prioritizing outside perspectives may reinforce that concern. C is incorrect because the opening statement appears supportive, but the counselor quickly shifts into telling the client what counseling will require. This may communicate that the counselor has already reached conclusions about the client before fully understanding their perspective. And D is incorrect because asking about the client's belief could encourage exploration, making this a reasonable response. However, compared with B, it does not first acknowledge the client's experience or communicate the counselor's collaborative role. With a client who already feels judged, establishing understanding before further questioning is the stronger response. So the skill you would need to know for a question like this or a scenario like this, you need to know how counselors establish relationships through trust, respect, empathy, collaboration, consistency, and attention to the client's perspective. When clients feel judged, pressured, or understood, the counselor should avoid becoming defensive or immediately trying to convince them otherwise. So again, as addiction professionals, we are engaging with people who are dealing with deep emotional, issues, pain. They are addressing things so they can work through them. So even though it doesn't matter what their perspective is, we have to show up with them to give them the opportunity, a space to verbalize their perspective, and so they can work through it. So it's not about like a right or wrong. It's more so, as a counseling skill, we show up and we focus on their perspective so they build that skill so they can address things and then they could correct things. So if we always make it about right, wrong, what other people think, they're more likely to like go back into a shell. Because remember, they may not have that skill. So sometimes people who are not in the field get that mixed up. They go, don't be manipulated. Y'all are getting manipulated. No, we're not getting manipulated. The core foundation of being a therapist, an addiction therapist, is to sit in a space with someone and just listen to them, hear them, look at their perspective. We didn't say right or wrong. We're just saying, okay, we're here to listen, and we're supporting them with working through what they think is helpful for them. But I know sometimes people say that. But yeah, so B is right. It's about giving the client space for their perspective, and immediately, letting them know, I see how you can feel that way. Question 7. A client entering substance use treatment states that they are unsure whether they want to continue counseling because previous treatment programs felt judgmental and focused primarily on telling them what they were doing wrong. Which counselor response best reflects best practices in client engagement? A. Before deciding whether treatment is right for you, I like to understand what was helpful or unhelpful about your previous experiences and what you will want to be different this time. B. Treatment can feel uncomfortable at first, but staying committed to the process will give you the best opportunity to achieve sobriety. C. We can avoid discussing areas that made you uncomfortable in previous treatment until you feel completely ready to address them. Or D. Let's review your previous treatment recommendations so we can determine which interventions you did not have an opportunity to complete. Which response best reflects best practices in client engagement? So your client feels judged. From their perspective, they felt like the treatment was focused on telling them what they were doing wrong. How do you respond? The correct answer is A. A is correct because the counselor demonstrates curiosity, collaboration, and respect for the client's previous experiences. Rather than assuming why treatment was unsuccessful, the counselor invites the client to identify what worked, what didn't work, and what they would like from the current treatment experience. This increases the client's active participation in the counseling process. B is incorrect because encouraging continued treatment can be appropriate, but this response moves quickly towards persuading the client to remain in treatment. It does not explore the client's concerns about feeling judged during previous treatment. C is incorrect because counselors should respect readiness and avoid unnecessarily pushing clients. However, engagement does not mean promising to avoid difficult clinical issues. sensitive topics may still need to be addressed appropriately as a part of effective treatment. And D is incorrect because reviewing previous treatment recommendations could provide useful clinical information, but beginning with what the client failed to complete, may reinforce the client's concern that treatment focuses primarily on what they have done wrong rather than understanding their experience. So for a question like this, the skill you need to know is effective engagement includes active listening, respect, collaboration, individualized care, attention to client concerns, strengths, preferences, and readiness for change. So you're looking for responses that helps the counselor understand the client before attempting to persuade, direct, or correct them. So again, client says something didn't work. So just generally in counseling practice, you want to refrain from saying something didn't work, because remember, as professionals, we know sometimes a treatment just may not be appropriate, or the formatting of a particular intervention just may not work for that particular client, but it doesn't mean that it doesn't work. So A would be the most appropriate. So you're just trying to figure out what was helpful, what was unhelpful for this client's experience. Question 8. During an initial counseling session, a client begins discussing the impact of their substance use on their family. The counselor wants to use appropriate attending behaviors to communicate presence and interest while allowing for the individual and cultural differences. Which counselor behavior best demonstrates effective attending? A. Face the client directly, maintain steady eye contact while the client speaks, use an open posture, and lean forward during emotionally significant parts of the conversation. B. Position the body toward the client, maintain an open, relaxed posture, use natural eye contact based on the client's comfort and cultural context, and lean appropriately as the conversation develops. C. Sit at a slight angle to reduce pressure, maintain a relaxed posture, periodically nod, and allow the client to determine when eye contact occurs during the conversation. Or D, maintain an open posture and comfortable eye contact while matching the client's body posture and nonverbal behaviors to communicate connection and understanding. So which one best describes effective attending? So the time you're spending with the client and attending to their needs, completing interventions, completing therapy interventions. Which one is the best? And there's a clue in one of these answers that should make it obvious which answer is the best. The correct answer is B. B is correct because it provides the most complete use of attending behaviors while recognizing that they should be natural and responsive to the individual client. The counselor appropriately orients towards the client, remains open and relaxed, uses culturally responsive eye contact, and leans when appropriate. So the key word here was cultural context. And remember, this is the exam. This is for exam world. A is incorrect because most of the behaviors are appropriate, making this a strong option. However, steady eye contact can become uncomfortable or intrusive. So if you're just constantly staring because you're like, I want to keep eye contact because it shows respect, it shows I'm listening, well, that would mean you're only leaning on one context, cultural context. If they're from a different culture where constant eye contact can be a sign of disrespect, or it can just be creepy, then you might have an issue. C is incorrect because sitting at an angle, remaining relaxed, and allowing natural eye contact can all be appropriate depending on the client. However, the counselor becomes somewhat passive in demonstrating attending. Effective attending requires intentional nonverbal communication rather than relying primarily on the client to establish the interaction. D is incorrect because an open posture and comfortable eye contact are appropriate, but deliberately matching or mirroring the client's body position and behaviors is not the same as attending, and if done mechanically, can appear unnatural. The counselor should respond naturally rather than imitate the client's moves. So typically, you're going to be facing your client, you're going to have an open posture, leaning. For exam world and book world. And then you have appropriate eye contact based on the cultural context, what they feel like is comfortable or what you've learned about the client. And I say exam world because I've ran adolescent and teen groups where I say you can sit anywhere you want. you can sit anywhere you want. You can sit in the group circle. You can sit on a beanbag, whatever you feel most comfortable. Remember, that's real world. That's real world. So don't get in the exam, because it's a question like this. You would be like, so what if we're sitting side by side? What if the client wants to sit side by? Obviously, in real world, you're gonna meet all different types of people. I go with whatever makes them feel comfortable, whatever is appropriate. For exam book world, we're gonna go with, we're in an office. We're in a perfect world. We're in an office. We're sitting across from the client, and you're gonna go with the answer that is most person centered. And like I said, the telltale sign in this answer was cultural context. Question 9. During an addiction counseling session, a client states, "My family keeps checking on me, asking me where I've been, and questioning whether I'm using again. I know I've messed up before, but I'm tired of feeling like nobody trusts me." Which counselor response best demonstrates reflection of effect rather than simply reflection of content? A. You've noticed that your family has been monitoring you more closely because of concerns about your previous substance use. B. You understand why your family is concerned, but you also want them to recognize the progress you've made. C. It sounds frustrating and discouraging to feel like your past substance use continues to define how your family sees you. Or D. Have you talked with your family about how their questions are affecting your relationship with them? Which one demonstrates reflection of effect rather than reflection of content? So which answer best shows that you can see, understand how they're feeling, and you're reflecting it back rather than just reflecting back what they said? Okay. The correct answer is C. It sounds frustrating and discouraging to feel like your past substance use continues to define how your family sees you. C is correct because the counselor identifies and reflects the emotional experience beneath the client's words. A is incorrect because it accurately reflects the content. So nothing is really wrong with A per se, but it doesn't reflect the effect or the feeling or the emotional experience. B is incorrect because it identifies two sides of the situation, and it could be useful at some point. However, it introduces the idea that the client wants recognition for their progress, which the client did not say. And D is incorrect because this is an appropriate open-ended question, but it's not a reflection. The skill that you would need to know for a question like this, you need to understand reflection of effect, reflection of content, and what's the difference. Question 10. During an addiction counseling session, a client begins discussing the impact their substance use has had on their children. The client states, "My daughter asked me why I kept choosing drugs over her." The client becomes tearful, looks down, and remains silent for several moments. What is the counselor's best response? A. Allow the silence to continue while maintaining an attentive presence, giving the client time to experience and process the emotion before responding. B. After a brief pause, reflect. Hearing your daughter say that seems to have brought up a lot for you, and invite the client to describe what they are experiencing. C. Remain quiet until the client begins speaking again, allowing the client to determine when they are emotionally ready to continue the session. Or D. Allow a brief period of silence and then ask what the client believes their daughter needs from them now, using the emotional moment to explore motivation for recovery. Which is the best response? Your client is having an emotional moment, something that's triggering for her, thinking about what her daughter asked her, becomes emotional, crying, looks down, and is silent for several moments. What would be your best response? Okay. So what do you do with silence? For like just when you think of counseling skills, there's a place there's a place for silence. What do you do with it? The correct answer is A. Allow the silence to continue while maintaining an attentive presence, giving the client time to experience and process the emotion before responding. A is correct because the client is actively experiencing a significant emotional moment. You got to use silence to allow time for the client to process without pressure to immediately talk or explain. Now, I believe as therapists, this is just what I believe, we should get counseling for enough time to see how it is on the other side. Because if you don't know what to do with that silence, you're going to try to feel it. Because remember, we're talking about traumatic experiences. You're watching people cry, you're watching people break down, you're watching people physically in pain, emotionally in pain. And that can be overwhelming. And because usually we don't want to see people in pain. But remember, they have to figure out how to manage this. So sometimes we're seeing people in vulnerable moments and it really hurt. It starts to hurt you like, oh, this person is really hurting. I don't want to see a person hurt. So again, I believe you get better at using silence when you've been in therapy yourself. So you understand on the other side that this person, they're in a safe place. You're not going to see them hurt. You're in the space with them. So yes, it hurts to see somebody else hurt, or it bothers you to see somebody else hurt. However, I think it's easier to use that silence to support them in learning how to feel those difficult emotions when you've been a client yourself. Now, I didn't say you have to go to therapy to be a therapist, but I believe if you've been in a therapeutic experience, you become a better therapist. So B is incorrect because reflecting the client's emotion in an appropriate counseling skill would be okay after the client has had time to process. C is incorrect because allowing the client space is appropriate, making this a strong alternative. So C is close, but therapeutic silence does not mean the counselor must remain silent indefinitely until the client speaks first. D is incorrect because exploring the client's relationship with their daughter and motivation for recovery should be clinically valuable. It is at some point, but it moves too quickly from emotional processing. So the use of silence in therapy is supporting the client with processing emotion in a safe environment. So what they're asking you in this question is, do you know how to use therapeutic silence? Can you be intentional, attentive, and be able to support the client in those moments? All right, guys. Hour 1 is done. Good job, guys. I'm going to take a sip of my water. Oh, I took a sip of my coffee. Oh my gosh. That hour went by fast. We went over a little bit, so I'm gonna stay on track for trauma informed care. Who's staying for hour 2? Put a 1 in the chat if you can hear me. Okay, Queen Misty. Thanks, Della. Thanks, Jamie. Thanks, Cicely. Doreen, were you talking about C for question 10? No problem. No problem, Queen Misty. We usually start at 7, but for August we've been doing these extended sessions. No worries. Better late than never. We'll go back to 7 in September. So just for August, we've been doing these extended sessions. And then we'll do in December is the next time we'll do extended sessions like this. I might do 2 in December when everybody's like on break. I go on vacation every December. And I know you're not supposed to work on vacation, but this is kind of like a hobby for me. This don't feel like work for me. Sorry, guys. But when I go on vacation, I batch record. I come up with new ideas. I'm doing all this poolside, of course, but I just get more creative when I'm on vacation. So we have 1 more week of extended sessions, y'all. So next week we'll do another 3-hour, and then we'll go back to the 7 o'clock. Okay, no worries, Queen Misty. I look forward to your call. Okay, so I'm gonna go over real quick why for question 10 it's not C. So they're close though. So I'm gonna go back to it. Because you'll have questions on your exam that have strong distractors, meaning 2 or 3 of the answers will be right, but you're looking for the best answer, or 2 of the answers seem similar, but they're just small nuances. So for question 10, they're asking you the best response when the client becomes emotional. So A says allow silence to continue while maintaining an attentive presence. Give the client time to experience and process the emotion before responding. C says remain quiet until the client begins speaking again. Allow the client to determine when they are emotionally ready to continue the session. So the difference is because the C does allow the client space to process, but it doesn't mean you have to remain silent until the client speaks first. So I think that's the small nuance. A says you allow the client to process before responding. So you'll respond or the client will respond. C is saying you're going to let it be silent until the client responds. C is not incorrect. It's not saying that it's all the way wrong, but the best would be A. All right, hour 2. Hour 2 is trauma informed care. So Trauma-informed care is about understanding that a person's past experience may influence what we see in treatment. Trauma can be acute or chronic, meaning it just happened, or it's just something that immediately has affected the client, or something that's chronic that's been happening over time, more than a year. It can affect substance use, mental health, physical health, relationships, and overall functioning. As counselors, we need to recognize possible trauma responses, including changes in their behavior, emotional reactions, triggers, or avoidance. Trauma-informed care always emphasizes safety, trust, choice, collaboration, and client autonomy or empowerment. These principles should also guide treatment planning. And finally, trauma can affect the counselor as well. We have repeated exposure to clients' traumatic experiences and can contribute to vicarious trauma, which is why we as addiction professionals have to have boundaries. We have to be self-aware about the things that are affecting us and appropriate self-care. So what you need to be able to know about trauma-informed care in terms of skills: you need to be able to recognize trauma responses. You need to understand trauma-informed strategies. So how do you build safety? How do you gain trust? We have to try to reduce or prevent re-traumatization. So we don't want to re-traumatize the client or harm the client just for them to be able to talk or explain what has happened to them. We have to understand what they're comfortable with. We need to be able to respect their boundaries, and we need to be able to support their autonomy and even recognizing trauma. Because remember, a lot of our clients don't even see some of their experiences as trauma. We need to be able to develop trauma-informed plans. So it needs to be individualized care. We need to be able to identify what is helpful, what is most helpful, and what supports their recovery. And lastly, we need to be able to respond with awareness about ourselves. So we also need to be able to validate and listen, and also take care of ourselves in terms of the effects of trauma when it pertains to professionals and when we're working. Question 1. A client with a long history of substance use disorder presents for an intake. During the session, they disclose significant childhood abuse and mention feeling numb or spaced out whenever they feel stressed. When you ask them to discuss their triggers for relapse, they shut down, fold their arms, and look at the floor. Based on a trauma-informed clinical approach, what is the most appropriate next step? A. Shift away from relapse triggers and assess the client's current coping strategies to determine whether they have sufficient emotional regulation skills to continue the assessment. B. Normalize the client's discomfort, briefly explain that discussing relapse triggers is part of the assessment, and allow the client additional time to answer when ready. C. Acknowledge the change in the client's response. Offer choice about whether to continue or pause that area of questioning, and reestablish a sense of safety before proceeding. D. Use grounding techniques to reduce the client's distress, and then return to the relapse trigger questions once the client appears emotionally regulated. What is the most appropriate next step? Okay, you are engaging in an assessment. The client disclosed significant childhood harm, and they began to space out. They mention feeling numb whenever they feel stressed. And you can physically see them being affected by talking about this experience. Which one is the best answer or the best next step? The correct answer is C. C is correct because this response best reflects trauma-informed care. The counselor notices the behavior change without assuming exactly what it means, responds to the client's immediate needs, and gives the client control over whether to continue. So this promotes safety, trust, choice, and collaboration while reducing risk of re-traumatization. A is incorrect because it shifts away from relapse trigger and assess coping strategies. Assessing coping and emotional regulation is clinically appropriate and may eventually be useful. However, the immediate issue is the client's response to the trigger. B is incorrect because this response demonstrates patience and avoids immediately pressuring the client. However, telling the client that discussing relapse triggers is part of the assessment may still communicate an expectation that they need to answer. And D is incorrect because grounding can be appropriate and it can also be an trauma-informed intervention. But the problem is the assumption that once the client is regulated, the counselor should continue. Trauma-informed care will involve the client in deciding whether, when, or how to continue the discussion. So a question like this, the skill that's being tested is your ability to recognize possible trauma-related responses and modifying your clinical approach to promote safety. So they want to see if you can respond and ensure that the client is safe. Because everyone is going to have a different response to talking about traumatic experiences. You need to be able to, in real time, adjust your clinical approach to make sure the client is safe, that the client feels comfortable with discussing traumatic events or experiences. Question 2. When considering the intergenerational transmission of substance use disorder, what is the significance of a high ACE score? A, it suggests increased vulnerability to substance use disorder, primarily when adverse experiences occur alongside a family history of substance use. B, it indicates cumulative childhood adversity that should be considered clinically, although current substance use patterns are more predictive of substance use risk than the number of ACEs. C, it reflects a dose-response relationship in which greater exposure to adverse childhood experiences is associated with increased risk for later substance use disorders. Or D, it identifies increased vulnerability to behavioral health disorders generally, but does not have a meaningful relationship with the development of substance use disorders. So when you think about intergenerational substance use issues or disorders, what does it mean when a person has a high ACE score? They score high on the adverse childhood experience. Which answer is correct? And don't overthink it. These are wordy answers. When I have wordy answers like this, I break down each answer. I try to reword it in a simple form. Let's see what you're saying in the chat. Okay. All right. The correct answer is C. C is correct because the more ACEs a person experiences, the greater the risk. So it just means they're at a higher risk to develop a substance use disorder. Not that they definitely will get a substance use disorder. It just means the more traumatic experiences someone has reports on the ACE assessment or screening, the higher the risk that they would develop a substance use disorder. This is called a dose-response relationship. As the number of the ACEs go up, the risk also tends to go up. Again, does not mean because you have a lot of childhood trauma or you score high that you will. It just means you're at a higher risk. So intervention may be needed, or early intervention. A is incorrect because a person does not have to grow up in a family with substance use for childhood trauma to increase their risk. Family substance use can add to the risk, but it is not the only factor. B is incorrect because this answer is partly true because ACEs should be considered when understanding a client, but it downplays the importance of a high ACE score. Research shows that experiencing more adverse childhood events is connected to greater risk for problems later, including substance use. And D is incorrect because ACEs can affect many areas of a person's life, including their mental health, their physical health, their relationships, and substance use. So we cannot say that ACEs have little connection to substance use disorder. There's definitely a connection. So the skill that's being tested in questions about ACE scores, intergenerational risk, if you get a question about the risk of a person who has um, a parent with a substance use disorder, anything related to intergenerational risk and trauma and ACE scores, you need to understand how childhood trauma can increase a person's risk. Question 3. A client with a substance use disorder reports that their substance use has contributed to repeated family conflict, periods of unstable housing, and worsening symptoms of anxiety. From a trauma-informed perspective, which statement best explains the relationship between the client's substance use and trauma? A. The client's substance use may increase exposure to stressful and potentially traumatic experiences while also making existing trauma and mental health symptoms more difficult to manage. B. The client's substance use is primarily a coping response to earlier trauma, so treatment should focus on identifying the original traumatic experience before addressing current instability. C. The client's family conflict and housing instability should be treated as consequences of the substance use disorder rather than trauma-related concerns unless the client meets criteria for PTSD. Or D. The client's substance use and trauma should be addressed separately because combining these two concerns may interfere with determining which condition is primarily responsible for the client's symptoms. So which statement best explains the relationship between the client's substance use and trauma? So the client has a substance use disorder, reports that their use has contributed to family issues, homelessness, and then their anxiety has gotten worse. What is the relationship between substance use and trauma? Which one best explains it? The correct answer is A. Substance use can do more than result from trauma. It can also create new stressful or traumatic experiences and make existing problems worse. For example, continued substance use may contribute to family conflict, violence, neglect, unstable housing, or unsafe environments. It can also make existing anxiety, depression, or trauma symptoms hard to manage. Hence why we have to have knowledge on co-occurring disorders. If you haven't did the practice questions on co-occurring disorders, when you finish, you can go over there or check it out this week. B is incorrect because trauma can contribute to substance use, but we should not automatically assume that trauma came first. The relationship can go both directions. Substance use itself can contribute to new trauma and instability. C is incorrect because a person does not have to meet criteria for PTSD for an experience to be traumatic or clinically important. Family violence, neglect, housing instability, and other stressful experiences should still be considered when understanding the client's needs. And D is incorrect because trauma and substance use are often connected, so separating them completely can cause the counselor to miss important patterns. Trauma-informed care looks at how substance use, mental health, family functioning, and environmental stressors may affect one another. So A would be the best answer. The skill being tested in questions about the impact of substance use on trauma and vice versa. You need to recognize how substance use can contribute to new trauma increase instability, and worsen existing trauma or mental health symptoms. So it's layered. You need to remember it's layered. It can be complicated. So they can come in with a history of trauma, and the substance use can cause additional traumatic experiences. Question 4. During a counseling session, a client with a history of trauma begins using humor and changing the subject whenever the counselor asks about emotionally difficult experiences. The counselor is concerned that the client is avoiding important treatment issues. Which response best reflects a trauma-informed approach? A. Explain that avoidance can interfere with treatment progress and encourage the client to remain focused on the difficult topic while providing reassurance and support. B. Recognize the behavior as a possible protective response, acknowledge the shift in the interaction, and explore what the client needs to feel safe enough to continue. C. Redirect the discussion towards coping skills and cognitive restructuring until the client demonstrates greater readiness to discuss the traumatic experience. Or D. Respect the client's avoidance by discontinuing discussion of trauma-related concerns until the client independently indicates that they are ready to process them. Which one reflects a trauma-informed approach the best? So your client is laughing and using humor when the subject talks about traumatic or emotionally difficult experiences. Okay. The correct answer is B. B is correct because behaviors such as humor, shutting down, changing the subject, or becoming skeptical may function as a protective or survival strategy. Instead of asking, why is this client difficult or why is this client not cooperating, we as addiction counselors should consider what might be happening for them right now. What about this conversation is making them uncomfortable or making them shut down? Acknowledging the change and exploring safety promotes trust, choice, collaboration without forcing disclosure. A is incorrect because staying focused on treatment goals is important, but immediately labeling the behavior as something interfering with treatment can frame a protective response as resistance or non-compliance. Trauma-informed care asks the counselor to consider what the behavior may be communicating before pushing the client to continue. C is incorrect because coping skills and cognitive strategies will eventually be appropriate or used, but regulation and safety comes before cognitive work. If the client is becoming overwhelmed, the counselor should respond to the client's current state rather than immediately trying to change their thinking or move into another intervention. And D is incorrect because respecting the client's readiness is trauma-informed, but trauma-informed care does not mean completely avoiding traumatic-related concerns. The addiction counselor can acknowledge what is occurring, promote safety, and collaborate with the client without requiring detailed trauma processing. So for a question about what may appear as resistance or a safety behavior that people engage in when they're uncomfortable, they want to see if you can recognize behaviors that appear to be resistance or protective responses and how you respond to that. So again, questions like this, they want to see if you understand the nature of the work we do. We're not always going to have clients that are going to just sit down and talk about their trauma and be self-aware. We're dealing with all different types of responses. So they want to know if you can safely engage with a client who may be avoiding and not make it seem like they're being negative or clearly being resistant. We have to figure out how to support the client when they are addressing something that they're uncomfortable with. And it's not always because they don't want to do it. it's something that has made them feel safe in the past. So again, this client right here has used humor. They may really have a humorous personality, but they may not recognize that even when they're talking about something traumatic or something that's hurt them, they're still using it. They're using humor as a protective factor. Did I do 2 4s? Might have an extra question, y'all. A client referred for substance use treatment by the court states, I'm only here because they're making me come. Everybody keeps telling me what I need to do. The client appears guarded and expresses distrust of treatment providers. Which counselor response best demonstrates trauma-informed care? A, explain that participation is court mandated. Review consequences of noncompliance and allow the client to determine how much they participate during each session. B, acknowledge the client's concerns and recommend peer support services so the client can connect with others who have successfully completed mandated treatment. C, emphasize the client's strengths and previous successes while encouraging them to view court mandated treatment as an opportunity to make positive changes. Or D, clearly explain what aspects of treatment are required, identify where the client has choices, and collaborate with the client in developing goals within those requirements. Which one is a trauma-informed approach or response? Your client is mandated by the courts, so they're being made to come to treatment, and they clearly tell you, I'm only here because they're making me. Everybody keeps telling me what to do. They're guarded and they do not trust you. Which is the best trauma-informed response? The correct answer is D. Clearly explain what aspects of treatment are required, identify where the client has choices, and collaborate with the client in developing goals within those requirements. One moment. D is correct because this response combines several trauma-informed principles. So first, it demonstrates trust. So you're explaining and you're being open with them. Yes, there are some things that you are required to do because you're court mandated. It also gives the client a choice by telling them what they can control, what do they have an option to do. And then also it emphasizes collaboration by involving the client in developing treatment goals. Trauma-informed care does not mean removing legitimate requirements. It means being transparent about them working with the client rather than imposing the treatment on them. A is incorrect because being transparent about court requirements is consistent with trauma-informed care, but focusing only on consequences can increase the existing power imbalance. So basically, you may be working with clients who are being made to do treatment, so that's already a loss of autonomy, even if it's for their health and safety. When we are being told what to do sometimes with something as sensitive as our health, it can be difficult. So you don't want to focus on non-compliance because you're already assuming that there will be consequences or the person is somehow not going to do it. B is incorrect because peer support is one of the principles of trauma-informed care and could be helpful for this client. However, it does not directly address the client's immediate concern, feeling that others are controlling their treatment. The counselor should first establish transparency, choice, and collaboration. And C is incorrect because focusing on strengths reflects autonomy and empowerment, which is important in trauma-informed care, but encouraging the client to see mandated treatment positively may overlook the client's expressed distrust and lack of control. So D would be the best answer. Be honest about what the requirements are and support them in identifying where they do have choices. So that could be appointment times, days, interventions that feel most comfortable with them, how they want to show up in treatment, what they want to discuss, and then collaborate with them. So they know you have a choice, and you do have choices. Question 5. A client receiving treatment for a substance use disorder also has significant trauma-related symptoms, including nightmares, emotional dysregulation, and periods of dissociation. The client's current substance use disorder program provides trauma-informed care, but does not provide specialized trauma treatment. Which approach is most appropriate? A. Continue providing trauma-informed substance use disorder treatment and delay trauma-specific services until the client has maintained a sustained period of abstinence. B. Transfer the client completely to a trauma specialist so the trauma symptoms can be stabilized before substance use treatment resumes. C. Continue substance use disorder treatment while coordinating a concurrent referral for trauma-specific services with appropriate consent for communication between providers. Or D. Incorporate trauma processing into the client's current substance use disorder counseling sessions so both conditions can be addressed by the same counselor. Which is most appropriate? So you're working with a client receiving substance use disorder treatment. They have significant trauma-related symptoms. So nightmares, which probably is affecting daily functioning, sleep, emotional dysregulation, and then they disassociate. So they're feeling outside of their body. Which one is most appropriate? Let me check the chat. Okay. One of the answers should be obvious. If you know anything about co-occurring disorders, if you completed the co-occurring disorder practice questions, the correct answer is C. Continue substance use disorder treatment while coordinating a concurrent referral for trauma-specific services with appropriate consent for communication between providers. If you get any questions about treating a client with a trauma-related, behavioral health-related, mental health-related, in addition to substance use, let's say it all together. It has to be concurrent at the same time. Evidence-based research shows when a client has both a substance use disorder and a mental health disorder, or both a substance use issue, mental health issue, co-occurring, it has to be treated together. You don't hold one off until you treat the other, because you may exacerbate symptoms. You may put them at a higher risk. If you yourself cannot treat the mental health disorder, you refer them out and they receive both services at the same time. A is incorrect because the client does not necessarily need to achieve a set period of abstinence before receiving appropriate trauma services. So this is more, you're putting it in order. You're saying we're going to treat one and then treat the other, treating one condition and waiting to address the other, when appropriate co-occurring trauma and SUD can be addressed concurrently. B is incorrect. The client needs trauma-specific treatment, but that does not mean substance use disorder treatment should stop. Completely transferring the client will interrupt important recovery support. A better approach is to coordinate the services so both needs can be addressed. So I'm going to say, in perfect exam world, we're just an addiction counselor. But in real world, some of us are licensed counselors with an addiction specialty. So don't overthink it. So for me, I'm an LPC and I'm also a LSAT. So when I have co-occurring clients, I assess for both because I'm licensed for both. But in exam world, I would just assume that you're only an addiction counselor unless they say otherwise. So if you have a client with specific co-occurring needs, you're going to refer out to whatever out of your scope. D is incorrect because trauma-informed care does not automatically qualify a counselor to provide trauma-specific treatment. Attempting trauma processing without appropriate training, competence, or program resources could exceed the counselor's scope and potentially destabilize the client. So also, you can provide trauma-informed care, but not be specialized in trauma treatment. So you're doing all the things to make sure you build trust, that they have choice, that you're not re-traumatizing them. But if you find that they need specific trauma treatment, that's not within your scope. You will have to refer out. So the skill that's being tested for questions like this is recognizing the difference between trauma-informed care and specific traumatic services, and appropriately coordinating integrated treatment for co-occurring trauma and substance use disorder. Question 6. A client entering substance use treatment reports a history of several potentially traumatic experiences and current symptoms of anxiety, sleep disturbance, and avoidance. The counselor wants to conduct a brief initial screen specifically for possible PTSD to determine whether further assessment is needed. Which tool is most appropriate? The ACE questionnaire, the PTSD checklist, the life events checklist, or the primary care PTSD screen? Which screening tool is most appropriate? So your client is in treatment, has several traumatic experiences and symptoms of anxiety. The correct answer is the primary care PTS screen. This screen was developed for primary care providers, but it can be completed by substance use clinicians, mental health clinicians to screen. So remember, a screening is shorter than an assessment. For those of you who don't work daily in assessing and therapy, the screening are quick questionnaires that gives you answers about what's the next steps. D is correct because the PTSD-5, which is the primary care PTSD screening, is a tool used to identify people who may have PTSD and need additional evaluation. A positive screen does not mean they have PTSD. It just indicates that further assessment may be appropriate. So just like the depression screenings does not diagnose them, it just says, hey, there's something that needs to be looked into. A is incorrect because the ACE questionnaire looks at adverse experiences that occurred during childhood. It can help identify childhood adversity and associated risk, but it's not specifically a brief PTSD screening. B is incorrect because the PCL-5 measures the presence and severity of PTSD symptoms. It provides more detailed information about PTSD symptoms, but the question asks for a brief initial screening. And C is incorrect because the LEC5 identifies exposure to potentially traumatic events across a person's lifetime. So the ACE is childhood. The life events checklist is over a lifetime. And it does not specifically screen for PTSD. The skill that's being tested with questions like this, that are you able to select appropriate screening tools to understand the client's needs? So you need to understand the difference between a screening and assessment, and you need to understand how to pick the appropriate screening to warrant further assessment. Question 7. During an intake for substance use treatment, a client becomes noticeably quiet and begins staring into the distance while completing a trauma screening tool. The counselor is under pressure to complete all required screening forms within the scheduled intake period. Which response best addresses a common barrier to trauma-informed screening and assessment? A. Complete the remaining screening questions verbally and use a slower pace so the required information can still be obtained without extending the intake. B. Pause the screening, attend the client's current response, and use grounding or stabilization strategies before determining collaboratively whether to continue the assessment. C. Discontinue the trauma screen and document that the client is currently unable to participate reliably, then complete the remaining non-trauma portions of the assessment. Or D. Normalize the trauma questions can cause discomfort, remind the client that they may decline individual questions, and continue the screening once the client verbally agrees. So how do you respond? What's the best response? The trauma-informed response when a client is becoming quiet, they're shutting down because you're asking questions about their trauma. The correct answer is B. Pause the screening, attend to the client's response, use grounding or stabilization strategies before determining if you want to move forward. B is correct because trauma-informed screening requires the counselor to balance the need for information with the client's safety and ability to remain regulated. When a client appears to dissociate or shut down, the counselor should pause, attend to what is happening, and support the client with stabilizing. The decision about whether to continue should be made with the client rather than automatically pushing through the screening. So safety first. A is incorrect because slowing down may sound trauma-informed, but the counselor still should prioritize the client's safety over completing the screening. C is incorrect because stopping the trauma screen may be appropriate, but immediately deciding that the client is unable to participate removes the opportunity to collaborate and giving them choice. So you can put safety first, support them with stabilizing, and then let them decide. The counselor should also first respond to the client's needs and then determine whether the screening can move forward or you can move forward with the assessment. And D is incorrect because offering the right to decline questions, it does support choice. So that is trauma-informed. But simply obtaining verbal agreement to continue does not adequately address the client's dissociative responses. Regulation and safety should come before continuing the assessment. So the skill that's being tested in a question like this, you need to be able to recognize barriers to trauma-informed screening and assessment and balancing the need to gather information with safety, stabilization, engagement, and client readiness. So they want to know if you as an addiction professional can recognize when something is impacting the client's safety. And that literally can just be a conversation. A conversation can be triggering. So we have to make sure we're not A, re-traumatizing the client, but B, making sure they can safely get through screenings and assessment and treatment. So that's what they're testing when they ask you about trauma-informed engagement, whether that be with screenings, assessments, how you're conducting questionnaires, how you're helping them develop goals that address traumatic experiences. Question 8. A client with a significant trauma history reports becoming intensely alert when hearing loud noises, reacting quickly to perceived threats, and having difficulty calming down even after recognizing they are safe. Which explanation best reflects the neurological impact of trauma? A. Trauma can increase activation of the brain's threat response systems, contributing to heightened arousal and rapid survival responses, even when immediate danger is no longer present. B. Trauma primarily disrupts the brain's ability to accurately store long term memories, causing neutral environmental cues to be consciously interpreted as past traumatic events. C. Trauma reduces the functioning of the autonomic nervous system over time, making individuals less physiologically responsive to environmental threats but more emotionally reactive. D. Trauma strengthens higher order cognitive processing during stressful situations, which can cause individuals to overanalyze potential threats and experience prolonged anxiety. All of those sound correct to me. But which one best reflects how the neurological impact of trauma? So the client becomes alert when they hear loud noises, even though they know they're safe, but their body is responding like they're not safe. Let me check the stat. So which one best explains the neurological impact of trauma? The correct answer is A. Trauma can increase activation of our threat response. So when somebody goes through a traumatic experience, they may know that they're safe, but when they think or they have a trigger of the traumatic event, they physically get heightened, they get aroused. Their survival response kicks in even when they are safe. A is correct because trauma can affect the brain and nervous system so that the body's threat detection and survival system becomes highly sensitive. A sound, a smell, a situation, a word, a feeling, a place, an emotion can trigger the fight, flight, freeze, or fawn response, even when the person is currently safe. This helps explain symptoms such as hypervigilance, exaggerated startled responses, and difficulty calming down. B is incorrect because trauma can affect memory and reminders of trauma can trigger strong reactions. However, the client's rapid reaction to possible danger is not explained primarily by an inability to store long-term memories. So trauma can impact memory, but B does not best explain the impact of trauma on our nervous system. C is incorrect because trauma can dysregulate our nervous system, but it does not simply make the nervous system less responsive. Some trauma survivors may actually remain in heightened state of arousal and respond strongly to cues that resemble danger. And D is incorrect because during a strong survival response, higher level reasoning does not necessarily become stronger. A person may have more difficulty thinking calmly and evaluating the situation because the brain and body are prioritizing immediate survival. So D does not explain it the best. A explains it the best. For this question, you need to understand how trauma can affect the brain and the nervous system. How does it impact the way we respond to threats? We may overrespond, overreact. We may become hypervigilant, which can affect our daily functioning. Question 9. An addiction counselor who regularly works with clients with severe trauma histories notices that they have begun having intrusive thoughts about clients' traumatic experiences and increasingly views the world as unsafe. The counselor also feels emotionally exhausted but continues to care about and empathize with clients. Which condition best explains these changes? Burnout, because chronic exposure to workplace stress can cause emotional exhaustion and changes in professional functioning. B, compassion fatigue, because prolonged exposure to clients who are suffering gradually reduces the counselor's emotional capacity to provide care. C, vicarious trauma, because repeated exposure to others' traumatic experiences can lead to trauma-related symptoms and changes in the counselor's worldview. Or D, countertransference, because the counselor is developing emotional reactions to the clients that are interfering with professional objectivity. Which one of these explains what's happening to this counselor? So you have an addiction counselor. She regularly works with clients and they have severe trauma histories. So this may include physical, mental, verbal, sexual abuse, childhood abuse, physical injuries. The client is having intrusive thoughts. They feel like the world is not safe. They are emotionally exhausted. They care about their clients. They still want to work, but they're just feeling emotionally exhausted. Which one is happening? Which answer is explaining what's happening to this client, to this counselor? Is it burnout, compassion fatigue, vicarious trauma, or countertransference? The correct answer is C, vicarious trauma. C is correct because this occurs when repeated exposure to other people's traumatic experiences begin to affect the helper emotionally and psychologically. Important signs of vicarious trauma is heightened stress, emotional exhaustion, intrusive thoughts about others, about their trauma, and then it changes the way you see the world. A is incorrect because emotional burnout can include emotional exhaustion. It can also, you can have reduced effectiveness at work or daily functioning. So this answer may sound correct, but burnout is more closely connected to ongoing workplace stress or ongoing repeated tasks that's burning you out. The intrusive thoughts about clients, trauma, and the change in the worldview points more to vicarious trauma. So they all can kind of overlap, and you may hear these words, but there's like little small nuances, differences. When I think of burnout, I think of a repeated task. Like it could be work related, but it could be everything. You're just doing all the things until you can't do them anymore. You're burnt out, you're tired. Vicarious trauma is more related to being exposed to the traumatic experiences and it's changing the way you see things. B is incorrect because compassion fatigue can develop from prolonged exposure to people who are suffering and may include emotional exhaustion, helplessness, and decreased ability to empathize with people. However, this counselor continues to feel empathy. So that's the difference. So with compassion fatigue, the way I remember how it's different is you kind of start not to care. I know that's a basic definition, but that's just how I remember the differences. So compassion fatigue is you may be working and seeing so many things that you started not to care, or you may be emotionally numb. This counselor says she still cares about her clients, or they still care about their client. They just feel scared of the world. And D is incorrect because countertransference is when the counselor's emotional reactions toward a particular client, they take their personal experiences and they're looking at the client from their own personal experience. It can affect objectivity. It crosses boundaries. This is not what's happening here. The skill is being tested in questions about us as addiction professionals when the counselor or the professional is being impacted in a negative way by being exposed or by doing these tasks over and over and over again. You need to be able to recognize signs of vicarious trauma and signs that you're being affected by the work you do. You need to be able to distinguish between vicarious trauma, compassion fatigue, and burnout, because these are like what happens to some of us. But obviously, you also need to understand self-care and when to take care of yourself, when to establish boundaries so that you can take care of yourself, because that is an ethical thing. If you don't take care of yourself, how are you going to take care of your clients? And question 10, An addiction counselor has been working with several clients with significant trauma histories. The counselor notices increasing emotional exhaustion and finds it difficult to stop thinking about clients' experiences after work. Which strategy would best help prevent secondary traumatization while maintaining effective client care? A. Establish a structured plan that includes regular supervision and debriefing, clear professional boundaries and workload monitoring, peer support, and consistent self-care practices. B. Increase the use of reflective practice and personal counseling to process emotional reactions while maintaining the current workload and clinical responsibilities. C. Work with a supervisor to periodically rotate high-stress cases and reduce exposure to trauma narratives while strengthening boundaries with clients who require intensive emotional support. Or D. Develop a consistent wellness routine that includes scheduled breaks, exercise, mindfulness, and separation of work-related activities from personal time. Which one would best prevent secondary traumatization? All of those sound pretty good. But for this scenario, the client has been working with clients with significant trauma histories. They're becoming emotionally exhausted. Keeps thinking about the clients and experiences and what they heard and what they're working through. The correct answer is A. Establish a structured plan that includes regular supervision and debriefing, clear professional boundaries, workload monitoring, peer support, and consistent self-care practices. A is the best answer because it's the most comprehensive. Secondary traumatization is best addressed through multiple layers of support. So you see where they have the professional support through supervision and debriefing. Also, professional establishing boundaries, monitoring how much they work, and then they have peer support, and then consistent self-care practices. B is incorrect because reflective practice and personal counseling can help, but the response leaves the workload, and the exposure unchanged. So you can't address it if you continue to work the same caseload, you get exposed to the same level of traumatic experiences, and you don't address that. C is incorrect because rotating high stress responsibilities and maintaining boundaries are legitimate strategies. However, prevention should not focus on reducing exposure to clients or their trauma narratives. We as addiction professionals also need supervision. We need opportunities to debrief and talk about your client caseload and interventions and how you're processing. We also need self-care and ongoing monitoring of their own reactions, because you have to monitor your reaction to changes, because if something doesn't work, you may want to consider a different caseload or changing positions or taking leave. D is incorrect because exercise, mindfulness, and breaks are all appropriate forms of self-care, but the weakness in this answer is prevention is almost on the individual counselor. Effective prevention also involves professional and organizational support. So A is the best answer because it's comprehensive. It touches professional, personal, individual, work support, home support, personal support, and self-care. The skill that you're being tested on in a question like this is understanding self-care and understanding that the work we do, we're being exposed to traumatic experiences, and we need a comprehensive strategy for prevention and to address it if it does happen. Right? And that is hour 2. Let's take some deep breaths. We said trauma. How many times did we say trauma? Take a swig. All right, study partners. We are at the home stretch. We shouted you out, Francois. Am I pronouncing your name correctly? I hope so. You're gonna have to go to the playback. I shouted you out at the beginning. Congratulations. I'm keeping up with the shout outs now, y'all. Because in the beginning, I kind of had a little bit of, I don't know, imposter syndrome, maybe? I don't know. I was like, okay, a couple people passed. All right. And then I was like, wait a minute. Let me shout these people out. We are doing it, y'all. We are doing it. So, congratulations again. All right. Hour 3 is focusing on cultural competency. Cultural competency is about understanding that culture can influence how a client experiences treatment and recovery. Our clients' values, beliefs, family expectations, communication style, and views about substance use or mental health issues can all influence how they engage with us. Counselors also need to understand that culture can influence observed behaviors. Things like eye contact, emotional expression, communication style, or interactions with authority may have different meanings across cultures. We should not automatically interpret a culturally appropriate behavior as a symptom or a problem. That's why it's important to distinguish between cultural norms and when something is wrong. Before labeling a behavior as abnormal, explore whether that behavior is consistent with the client's cultural background or their experiences. We also want to recognize cultural stressors like discrimination, stigma, language barriers, and environmental factors that may affect the client's mental health, substance use, and recovery. Culturally responsive counseling requires us to explore rather than assume. Ask questions about their values, beliefs, preferences, and what recovery means to them. Evidence-based interventions can still be used, but they may need to be adapted so they are relevant and respectful of the individual client. What you need to be able to do in order to be culturally competent. So, your skills. You need to be able to explore clients' cultural values and not make assumptions. So, ask questions, listen to how the client describes their experience. You also need to recognize how their culture may influence their behavior and their communication. A major clinical skill is being able to distinguish between if something is a symptom or is it a cultural norm. Counselors should also be able to adapt counseling strategies when appropriate. Throughout the therapeutic process, we demonstrate respect for culture and lifestyle diversity. So we're always exploring and coming from a place of learning so we can provide the best care and treatment and interventions to our clients. Question 1. During an assessment, a client consistently avoids direct eye contact, speaks quietly, and pauses before responding to questions. The counselor is unsure whether these behaviors reflect anxiety, guardedness, or the client's cultural communication style. What is the most culturally competent response? A. Explore whether the behaviors occur across different settings and relationships and assess whether they can cause distress or interfere with the client's functioning before determining their clinical significance. B. Explore the meaning of the behaviors within the client's cultural context and consider whether they represent culturally normative communication before interpreting them as symptoms. C. Ask the client how they typically communicate with authority figures and compare this information with other assessment findings before determining whether anxiety is present. Or D. Continue observing the behaviors over several sessions and avoid assigning clinical significance until a consistent pattern can be established. Which one is the most culturally competent response? So you're doing an assessment. The client is not looking at you, avoiding eye contact. They're quiet. They're pausing before they answer. How do you respond? Thank you, Doreen. I really appreciate you. The correct answer is B. B is correct because cultural competency requires the counselor to consider whether an observed behavior is a norm or a symptom. Reduced eye contact, quiet speech, or pauses may communicate respect in some cultures. The counselor should explore the client's meaning and cultural norms rather than assume the behavior represents anxiety or paranoia. A is incorrect because context, distress, and impairment are important when evaluating symptoms, but the question specifically highlights behavior that may have a cultural meaning. The addiction counselor should directly explore cultural context rather than relying primarily on functional impairment to determine what the behavior represents. C is incorrect because asking how the client communicates with authority figures could be useful and it could provide important information about their culture, but this response would be too narrow because you're making an assumption about the behavior. And D is incorrect because avoiding premature conclusions is appropriate, but just observing the client for additional sessions does not address the need to actively explore cultural influences. So, cultural competency requires curiosity and discussion. So, you just don't wait for the pattern or the behavior to be addressed. The skill that's being tested for questions like this, you need to be able to distinguish between what's culturally normal for your client and what can be an issue or a symptom or something deeper. So you need to be able to explore cultural meaning in every client. Your clinical interpretation will change based on the client's culture. Question 2. A client entering substance use treatment explains that major decisions are typically made with input from family members and that recovery should include support from their family and faith community. The counselor's usual treatment approach emphasizes individual decision making and independent recovery goals. What is the most culturally responsive approach? A. Develop individual treatment goals with the client and incorporate family and faith supports after the client demonstrates consistent engagement in treatment. B. Explore how family and spiritual beliefs have influenced the client's substance use and recovery while encouraging the client to maintain independent responsibility for treatment decisions. C. Explore the importance of family and faith in the client's life and with the client's consent, incorporate culturally relevant supports into treatment and recovery planning. Or D. Include family and faith community representatives in treatment planning while maintaining the counselor's responsibility for determining which recommendations are clinically appropriate. Which one is the most culturally responsive approach? Your client says they make decisions with their family and their faith community. You usually use treatment interventions and approaches that are about the individual making their own decisions independently. Which one would be the best response, culturally appropriate response? Okay, C, B, I see C. The correct answer is C. C is correct because cultural values can influence decision making, family involvement, spirituality, help seeking, and beliefs about recovery. The addiction counselor should explore what these factors mean to the client rather than make assumptions. With permission, culturally relevant supports can be incorporated into the treatment plan. A is incorrect because individual goals may be appropriate, but this response assumes that independence should remain the primary treatment framework. Waiting to incorporate family also overlooks the resources that the client has already identified as important recovery. So the client has already identified that they make decisions with their family and their faith community that should be incorporated. You should make that a part of treatment. So you need to get release of information forms. You need to review it with the client, review what that means for their records, because they've already expressed that that's typically how they make decisions and that's how they want to make decisions. B is incorrect because exploring family and spiritual beliefs is culturally responsive. And this may have been a close distractor, meaning it may look like the correct answer, but it's not the most culturally responsive. The counselor redirects the client towards independent decision making rather than determining how the client's own cultural values can appropriately guide treatment and recovery. So the part where it says encouraging the client to maintain independent, that is not culturally responsive because the client has expressed that they make decisions with family members and their faith community. D is incorrect because involving culturally relevant supports may be appropriate, but the counselor should not automatically involve family or community members simply because they are culturally important. So you got to get consent again. Preferences, confidentiality, and appropriate boundaries still apply. So the skill being tested with questions like this, you need to be able to identify culturally based factors that may influence treatment and recovery. So you have to consider your client's values, their preferences, and how they see treatment. One moment. Let me get my spoon. Question 3. During a substance use assessment, a client frequently looks to an older family member before answering questions and allows the family member to speak on their behalf. The counselor initially wonders whether the client lacks motivation or is overly dependent on others. What is the most culturally responsive interpretation? A. Explore whether the behavior reflects cultural values related to family roles, respect, or shared decision making before determining its clinical significance. B. Assess the client individually to determine whether reliance on the family member reflects limited confidence or difficulty making independent treatment decisions. C. Ask the client whether they would prefer the family member to remain involved while separately evaluating whether the behavior represents avoidance of personal responsibility. Or D. Respect the family's interaction style during the assessment, but encourage the client to answer independently so the counselor can accurately evaluate motivation and readiness for change. What is the most culturally responsive interpretation? The correct answer is A. Explore whether the behavior reflects cultural values related to family roles, respect, or shared decision making before determining its clinical significance. A is correct because culture can influence how people communicate, interact with family, respond to authority, and make decisions. Looking to an older family member before responding may reflect respect, family hierarchy, or shared decision making, rather than dependence or lack of motivation. The counselor should explore the meaning of the behavior within the client's cultural context before making clinical judgment. This is related to this, but many people culturally, they have that person that supports them in whether it's filling out paperwork intake. My husband, he'll be like, I'm gonna put your email. I'm like, okay. So husbands might put y'all know how husbands act when they go to the doctor or somewhere. So you really have to explore, what is that about? That doesn't mean the person isn't motivated. That may be their person that they seek for support. That person may be their support system, the whole reason why they're there. But don't assume that it's lack of motivation or they don't want to do it or they don't understand. Just make sure you're explaining to them what that looks like. If they want the person there, if they want the person to receive their paperwork, what release forms need to be sent, what needs to be on file. So A is correct. B is incorrect because individual assessment may sometimes be appropriate, but this response begins with the assumption that relying on family could indicate limited confidence or impair independence. The counselor should determine whether the behavior is culturally normative before interpreting it as a clinical concern. C is incorrect. Asking about the client's preference for family involvement is appropriate, but the second part assumes the behavior may represent avoidance of personal responsibility. They may just feel more comfortable with that person. D is incorrect because respecting the family's interaction style is appropriate, but requiring more independent responses assumes the individual decision making is the preferred standard. The client's cultural values may place greater importance on family participation and collective decision making. The skill that's being tested in questions like this about maybe client support or the client's need for additional people to be a part of their treatment. You need to be able to recognize how culture can influence observed behaviors. So what you see, you can't assume what it means because it may have a different meaning for them depending on the cultural context. So you need to be able to explore cultural meaning. And before saying the behavior is a deficit or a symptom, you need to just get clear understanding. Question 4. Which counseling approach best demonstrates culturally competent practice in substance use treatment? A. Explore the client's cultural values and treatment preferences while using evidence-based interventions that are consistent with the client's identified clinical needs. B. Use evidence-based interventions as designed while inviting the client to discuss cultural factors that could create barriers to applying the interventions outside of treatment. C. Explore the client's cultural values, beliefs, communication preferences, and recovery practices and adapt evidence-based interventions when appropriate while maintaining their clinical purpose. Or D. Incorporate culturally recognized healing practices into the treatment plan when they are consistent with the client's background and can complement evidence-based substance use interventions. Which counseling approach best demonstrates culturally competent practice in substance use treatment? Which one best demonstrates it? The correct answer is C. C is correct because this response combines the major elements of culturally competent counseling, exploring rather than assuming, understanding the client's individual cultural values and preferences without losing the intervention's clinical purpose. The counselor works works to make treatment both clinically appropriate and culturally relevant. A is incorrect because the counselor explores cultural values and considers the client's preferences in this choice, but it stops short of specifically addressing the counselor's responsibility. So the counselor's responsibility is to adapt the delivery of the interventions when appropriate. So it's more than recognizing the culture. You have to adjust when appropriate. B is incorrect because this response appropriately uses evidence-based treatment and considers cultural barriers, but the counselor is primarily asking how culture affects the client's ability to fit the intervention. True cultural competence will show the counselor considering whether the intervention itself should be appropriately adapted to better fit the client. And D is incorrect because incorporating culturally relevant healing practices may strengthen treatment and can be appropriate, but the counselor should not select a practice simply because it's associated with the client's cultural background. The counselor must first explore whether that practice is meaningful and preferred by the individual client. So the skill that's being tested is your ability to apply evidence-based, culturally competent strategies. So can you adapt or change? Are you flexible in your interventions to fit the client's cultural values and preferences? Question 5. Which approach best reflects the use of culturally relevant practices in substance use treatment? A. Integrate cultural traditions and community supports that are commonly associated with the client's cultural background while evaluating their effectiveness throughout treatment. B. Ask the client which cultural beliefs influence their understanding of substance use and use those beliefs to select evidence-based interventions that have demonstrated effectiveness with similar cultural populations. C. Maintain the core component and collaboratively incorporate them into treatment when appropriate. Which one best reflects use of culturally relevant practices in substance use treatment? Okay. Okay, I see some. Okay. The correct answer is D. Explore which cultural identities, values, practices, and sources of support are personally meaningful to the client and collaboratively incorporate them into the treatment when appropriate. D is correct. This answer puts the individual client at the center of determining what is culturally relevant. The addiction counselor explores rather than assumes and collaborates with the client to determine whether their family, spirituality, community, and other cultural factors should be incorporated into treatment. A is incorrect because incorporating cultural traditions and community supports can be appropriate. So the problem with this answer is it assumes that practices commonly associated with a cultural group are meaningful to this particular person. So you may have done your research, you may have done supervision, prepared for this client, you may know the cultural background, but it still doesn't mean that those interventions or those supports is going to be what this particular client wants. So there's still levels. B, incorrect. The counselor does ask about the client's beliefs and uses evidence-based treatment, but selecting interventions based on what has worked with similar cultures is still a generalization. The addiction counselor needs to consider the individual's client's preferences, needs, and experiences rather than assuming that an approach will fit them because it worked with others of the same or similar cultural group. Because remember, we're still individuals, and your client may be from the same cultural background as you. So you may think you got it in the bag. You're assuming. Or you may be familiar with the client's culture. You might go, okay, I know how to show up for this client. And they may express they want to do something different, or I'm unconventional, or I want to use something, I want to try something else that might not match my cultural traditions. And C is incorrect because adapting communication, examples, and activities can make an intervention more culturally responsive, but the adaptations are based on the counselor's understanding. So remember, another thing about being a culturally solid counselor is understanding when you're not a part of a culture, you're still on the outside of the culture. So your perspective of that culture is from a person on the outside. So you still need to come from a place of learning. So you may have a certain level of understanding. You may have married into a culture. You're still not of that culture. You have a special perspective. So you still have to come from a place of learning and not assuming. Because again, we're all individual. The skill that's being tested for a question like this is, are you able to select culturally relevant approaches based on the individual's client's values and preferences without making assumptions? So even if you have background and you have understanding of that culture, even if you're a part of that culture, you still have to come from a place of what is your preference as a client. Question 6. Which counseling techniques best demonstrates culturally relevant practice when working with a client receiving substance use treatment? A. Adjust the counselor's communication style to reflect cultural norms commonly associated with the client's background while monitoring whether the client appears comfortable with the approach. B. Ask the client about preferred communication styles, family involvement, cultural supports, and beliefs about recovery, and use that information to collaboratively adapt counseling techniques. C. Use culturally adapted evidence-based interventions that have demonstrated effectiveness with the client cultural population, with allowing the client to request modifications when needed. Or D. Maintain the core counseling approach while incorporating culturally familiar language, examples, and recovery resources that are consistent with the client's identified cultural background. Which one is best demonstrates culturally relevant practices? The correct answer is B. So B should immediately stood out for you because it starts with ask the client. You don't adjust anything, you don't use anything, and you don't automatically say, I'm not going to change anything. That's basically what A, C, and D. A is saying, oh, I'm going to adjust my style, which seems like a nice gesture, but no, don't adjust anything until you build rapport with the client, ask the client what their preferences are. C, you're already using something. It starts with use culturally adapted evidence. Remember, even if you're familiar with the culture, you understand the evidence-based practices that may have worked or you may be familiar with, you still don't know this particular intervention this particular client and their preferences. And then D, maintain the core counseling approach. So basically that went the other direction. So you can't go in saying, I'm going to use what I've been using, because that wouldn't be culturally competent. You want to ask the client, go in with curiosity. So that's basically why B is correct. Question 7. Which statement best reflects cross-cultural competency when providing mental health and substance use services? A. Counselors should develop knowledge of the beliefs, communication patterns, and treatment practices of major cultural groups so they can anticipate differences that may affect treatment. Okay. B. Counselors should recognize their own cultural perspectives and biases Seek to understand the client's individual cultural worldview and adapt communication and services through ongoing collaboration. C. Counselors should use standardized assessment and treatment practices consistently across cultural groups while considering cultural modifications when those practices create barriers to engagement. Or D. Counselors should prioritize the client's stated cultural preferences while using professional judgment to determine which cultural factors are clinically relevant to mental health and substance use treatment. Which one is best reflects cross-cultural competency? The correct answer is B. So recognizing your own perspective, your own biases, and seek to understand the client's worldview, and then adapt that to your services and your interventions. A is incorrect because learning about different cultural groups can increase your awareness, but you only can learn generalizations. So that doesn't mean you have cross-cultural competence. So you can't rely on that type of information. So you still have to get to know the client's worldview. C is incorrect because consistency in clinical standards is important. But you can't provide the same approach to every client. That would be cookie cutter. That is the opposite of person-centered care. That is the opposite of being culturally competent. And D is incorrect because this answer shows the respect of the client's stated cultural preferences, but cross-cultural competence goes beyond deciding whether a cultural factor is clinically relevant. The addiction counselor should explore how culture may influence the client's communication, how they seek help, how they see recovery, not just from the counselor's clinical perspective. Question 8. Which counselor response best demonstrates appropriate exploration of the client's cultural values during substance use treatment? A. Ask open-ended questions about beliefs, traditions, relationships, and cultural experiences are important to the client and how the client believes they may influence treatment and recovery. B. Review cultural factors commonly associated with the client's identified background and ask the client which of those factors should be considered when developing treatment goals. C. Explore cultural values that appear directly related to the client's substance use while allowing the client to introduce other cultural concerns if they become relevant during treatment. Or D. Ask the client to identify cultural practices that have supported them in the past and incorporate those practices into treatment when they are consistent with the counselor's recommended recovery approach. So which one demonstrates appropriate exploration of a client's cultural values in substance use treatment? So how do you learn about the clients, what's important to the client? Look at the chat. Okay. Okay. Which is the best way to explore the client's values? Do you ask open-ended questions? Do you review the cultural factors, like do some research? Explore what directly is related to their substance use? Or ask the client about practices? The correct answer is A. A is correct because cultural values should be explored and not assumed. So open-ended questions allow the client to identify what is actually meaningful to them. B is incorrect because asking the client which factors apply is better than automatically assuming, but the counselor is still starting with a list of characteristics associated with the culture. So this kind of limits the conversation to generalizations or stereotypes. So you want to allow the open-ended questioning piece allows the client to define what their own cultural experience is. C is incorrect because focusing on factors related to substance use is from a clinical perspective, but cultural values can influence much more than substance use itself. So it is substance use interventions and treatment, but there are other factors like how do they feel about coming to treatment? What's their family involvement from their cultural perspective? How do they communicate? How are they coping? Not just how it relates to their use. And D is incorrect because cultural practices should not be accepted only when they fit the counselor's preferred recovery approach. So you learn about the client first. You adjust as needed, as appropriate, as ethically as you can. Or you may need to refer out. If you feel like you can't treat the client within their cultural context, you may need to consider other options. But you don't come with your clinical view and make them fit into what you usually do. The skill being tested for this question is you need to be able to identify and explore the individual's client's cultural values and determine how those values may influence treatment. And then you figure out the next steps. Question 9. Which counselor behavior best demonstrates respect for culture and lifestyle diversity through the therapeutic process? A. Maintain consistent professional expectations for all clients while allowing clients to identify cultural or lifestyle differences that may require adjustments to treatment. B. Use respectful, non-judgmental communication, remain open to the client's values and lived experiences, and collaborate with the client to ensure treatment reflects their individual needs and preferences. C. Demonstrate acceptance of the client's cultural and lifestyle choices while keeping personal beliefs separate and focus treatment primarily on clinically established recovery goals. Or D. Incorporate the client's cultural and lifestyle preferences into treatment whenever possible while maintaining standard counseling strategies to ensure equitable care across clients. So which one best demonstrates that you have respect for cultural and lifestyle diversity when you're working with clients? Again, all these answers sound respectful, but one is the best and most comprehensive. The correct answer is B. B is correct because conveying respect involves more than simply accepting differences. The addiction counselor must demonstrate openness, curiosity, non judgment, and respect for the lived experience. A is incorrect because this approach places most of the responsibility on the client to identify when treatment needs to change. A culturally responsible counselor actively creates opportunities to explore differences that may affect the therapeutic process. C is incorrect because focusing only on the predetermined clinical goals may overlook how the client's culture influenced the goals and the recovery process. And D is incorrect because maintaining the same counseling strategies for everyone in the name of equality can overlook important individual differences. So equitable does not equal identical. So the care can be equitable and equal, but it should vary between clients because everyone is different. So the skill that is being tested in a question like this is your ability to convey respect for people's culture and lifestyle? And are you able to treat your clients from a non-judgmental perspective and respect their diversity and their differences? Question 10. Which statement best describes the range of cultural factors that may influence a client's substance use treatment and recovery process? A. Cultural factors primarily influence how clients communicate distress and seek help, while treatment decisions should remain based on standardized clinical assessment and evidence-based recommendations. B. Cultural factors influence treatment most strongly when clients experience acculturation stress, discrimination, language barriers, or difficulty accessing services, making assessment of these barriers essential to treatment planning. C. Cultural factors may shape how clients understand the causes of substance use, how they seek help, communicate and express distress, involve family or community supports, experience systemic stressors, and define meaningful recovery. Or D. Cultural factors should guide the counselor's understanding of family roles, communication patterns, and preferred healing practices, while environmental and socioeconomic stressors should be evaluated separately as psychosocial concerns. So which one of these best describes the range of cultural factors that influences treatment and recovery? So one of them describes it the best. The correct answer is C. Cultural factors may shape how clients understand the causes of substance use, seek help, communicate and express distress, involve family or community supports, experience systemic stressors, and define meaningful recovery. C is the best answer because this answer is most comprehensive. So culture can influence how they define addiction, how they seek help for addiction, how the family participates, and what successful recovery means to them. These factors should be explored individually and not assumed. A is incorrect because this answer limits culture primarily to the communication and help seeking. And cultural influences can extend to beliefs about addiction, family involvement, and other areas. B is incorrect because this answer focused on external barriers. Cultural considerations also include the client's internal barriers, like stigma. Will they be judged? What have they been told about addiction and getting treatment? And this directly affects how they seek help. So external and internal barriers need to be included. And D is incorrect because this answer separates environmental and socioeconomic stressors from the cultural picture. And they're all in there together. Community conditions, discrimination, access to services, and other environmental experiences, they interact with culture and they directly influence treatment and recovery. The skill that's being tested in questions about how culture affects treatment, whether it be barriers or external barriers, internal factors. As addiction counselors, we need to be able to recognize that there's a broad range of culturally based considerations that can influence the process of services. Okay. So key takeaways from all 3 hours. So if you're just joining, and hello to the playback if you're still here. Thank you. First hour was counseling skills. So we really mainly focused on active listening, showing empathy, building rapport. Second hour was based on trauma informed care. So, how we ensure our clients are safe, how trauma impacts the nervous system, how trauma impacts the client's um, care, and how trauma impacts us as mental health and substance use professionals. And the last hour was about cultural competent care. So, how we should not assume that we know our clients' preferences. We should convey respect for our clients' preferences. We should adjust when we can our clinical interventions and collaborate with the client in order to, have more a cultural acceptance of how our client shows up. And we need to be able to have ways that we can adapt our care just to ensure the client feels seen and heard, and just to make sure we continue to have a collaborative effort in treatment. So, all of these topics are connected. So, with counseling skills, remember that the foundation is the relationship. So, we want to learn the skills of listening and attending. We need to pay attention to both verbal and nonverbal communication. And before we expect clients to open up and make changes, we have to create a safe environment where they feel heard and respected. That connects directly to trauma informed care, so that we don't look at resistance and shutting down and those avoidance behaviors as something else or as a issue. We need to be able to recognize that trauma can impact how our clients show up. So we're going to be using those counseling skills to show up for our clients. And then cultural competencies adds another layer. A behavior we observe may be influenced by the client's culture, and we don't want to automatically label something as a symptom or assume we know what the client's perspective is. So when you put all three together, the message is understand the person before you interpret the behavior. So us as addiction counselors, we have to build the relationship, respond in a trauma-informed way, putting the client's safety first always, and then using our cultural competency to understand that the client and their experiences is always going to impact services from start to finish. We made it, study partners. We have completed our third intensive study group this month. It has went by so fast. Let me turn the camera on. It went by so fast. The 3 hours go by fast, but the month has went by fast. So we have one more left for August. Next week, hopefully you guys can join. It's going to be ethics. Overall arching. So that's the second most popular request. First most popular request, like I said before, is pharmacology basics or something with medication or pharmacology. Second most requested is ethics. So we're going to split it up into 3 hours of ethics because ethics is so broad. We're going to do some of the top ethical. I'm scratching my head. I forgot I was on camera, y'all. I'm sad. But we're going to break up the ethical topics over the 3 hours. So ethics in documentation, ethics in counseling interactions, confidentiality going to be in there. So hopefully you guys can join me. Let's see what you guys are talking about in the chat. Did it go back fast for you guys? Thank you guys so much for supporting the channel. We showed up for ourselves. But we made it. Another 3-hour session. Thank you guys. Yes. All right. Akila says, when would this be available to listen to again? Usually immediately, so within a couple hours. Or if you look down at your phone, you usually can, if you look at the bottom of the video and there's a way you can go all the way back to the beginning and it'll just take it off live. But the final video takes a couple hours to download. It won't allow me to change anything or anything. It just, you can play it automatically, but usually I might go back and, well, the first one, I had to do some editing. I think one of the lives, but this, now I'm just, the live is just as is. So you should be able to, play it back now. Thank you, Queen Misty. Appreciate you guys. It does go by fast. I told someone I was doing the 3 hour intensive. They was like, girl, no. You gonna sit there and run your mouth for 3 hours? Yes, I am. They were like, okay, I forgot. You can run your mouth for 3 hours. But no, I think intensive sessions have their place. I used to like those in school, like those extended classes where you go for 3.5 hours and you have to only go once a week. Sometimes you just need that time where you're in there longer. And then sometimes you need the hour ones. You're welcome. You guys are welcome. Thank you for supporting the channel. Like I said before, this initially started as a way for me to have evergreen content for my supervisees. But I already had a YouTube channel, so I just decided to see who else was out there studying for addiction counselor exams, who else was interested in addiction counseling. And we out here. First of all, it's 3,000 of us. Again, congratulations. Thank you to you guys. We have crossed the 3,000 threshold. So I really do appreciate you guys. It's only because of you. We're doing this together. I make the content and you guys are showing up and engaging, because I can't get into all that YouTube stuff. Like, I'm into it, but in order to grow, if you focus on everything that they tell you to do, you will be so overwhelmed. So I promised myself, I said, you know what? I'm just going to put the content out there and my people are going to find me. We're going to find each other. And we did. And we are doing just fine. You guys are liking, you guys are sharing. We're showing up, we're studying together. So this is our thing. Cause this content creating it's a lot to it. But it's fun. But it is a lot to it. Yes, Doreen. We are all over. We are in Cali, Texas, Virginia. Everywhere. Indiana. Florida. Lots of people from Florida. Maryland. Jersey. New York. And I'm glad you found us too, Letitia. Are you Letitia or Letitia? My mama put an E in my name. I don't know why she did that. I ask her all the time. It could have just been Lati. But she wanted to be fancy. So I'm not sure if you're Letitia or Letitia, but I'm glad you found the channel too. Yes. We even have some international study partners. Because remember, the ICNRC is international. So we had Brazil, a few other places, Canada. All right, you guys. Nice work. We made it through our 3 hours. Again, I appreciate you guys so much for supporting the channel. If you haven't already liked the video, go ahead and like it. If you're watching this on the playback, hey, glad you were able to make it. If you can't make it live, make sure you make the playback. Make sure you're subscribed so you don't miss any study or exam prep videos. I will see you guys next week. Take care.